Australia would be considered a world leader in emergency care.
We actually provide a trauma service of excellence.
If you're critically ill, Australia's public hospitals will look after you, no matter what your bank balance.
I've seen the development of the system here into something that is as good as you see anywhere in the world.
From the time at which I was presented with symptoms to diagnosis and treatment was very swift.
But for anything other than acute trauma, help can be out of reach.
My expectations of what our health system offers have been completely blown apart by this experience.
People who are well-resourced, educated, better off, receive more health care and a higher standard of health care than those people who are poorer and more disadvantaged.
Post-hip replacement, there's a lot of physical rehab required, and the hydrotherapy is really great because it's warm water, it makes your muscles really relaxed.
Sarah Chaundy started paying for private health insurance in her early 20s. She knew she'd need hip surgery one day because of a childhood medical condition.
I would say that I've had very good care. I do think that it is very expensive. I sometimes do question whether or not having private health is of benefit. However, I'm sort of proof that you never know what's going to just occur.
That cover may well have saved Sarah's life 2 years ago, when a standard health check delivered some abnormal test results.
The GP had said to me, do you have private health insurance? Because a colonoscopy is probably something you would be looking at having. But if you don't have private health insurance, then, we'll just monitor it, sort of thing.
In the public system, Sarah might have had to wait for months for a colonoscopy. But with private cover, she had the test just a couple of weeks later. It revealed she had stage 3 bowel cancer.
That was a huge shock. Yeah, massive. I'll never forget that day. I was 33, new mum, baby girl, 18-month-old. Had I not had the cover, would I still be here to tell this story? I don't know.
Public hospitals are the most prominent and costly element of the healthcare system.
In terms of the overall healthcare dollar, in terms of the hundreds of billions that we spend on healthcare in Australia, it's hospitals that actually eat up most of that.
Admissions are rising more quickly than population growth. Former Labor policy advisor Jennifer Doggett believes many could be avoided.
We have a very high rate of what's called preventable hospital admissions. So they're conditions that people experience which wouldn't necessarily lead to hospitalisation, but because they haven't received the care in the community that they need, they end up needing care in a hospital.
Despite government incentives for taking out private health insurance like a rebate, more than 50% of Australians still don't have basic hospital cover.
Certainly there's plenty of modelling which shows that people economically are much better off by just putting that money aside and using that to self-fund their healthcare expenses. It's not a net financial benefit.
Former Coalition advisor Terry Barnes says for most people, private cover is worth it despite the cost.
Private health insurance is about as popular as a part in the lift when it comes to being a purchase of a household budget. But it does do what it's advertised as doing. It does give people access to the doctor and hospital of their choice. It does give people a chance to have things done quickly if they're elective.
Sarah's cancer treatment and then a hip replacement earlier this year were done quickly, but she faced out-of-pocket costs despite being fully insured.
I've spent about $30,000 in total. So of that, about $10,000 has been out-of-pocket expenses and about $19,500 has been in insurance, private health insurance.
Part of the out-of-pocket costs problem is the fact that healthcare providers can charge whatever they like. Certainly we have seen some specialists, medical specialists, that do charge extremely large fees, and fees that even their colleagues have said are unjustifiable.
These excessive fees seem to be geographically based. They're very common in Sydney and Canberra, almost non-existent in Adelaide, and Melbourne's a little bit in between.
The country's chief medical officer has promised to investigate the amounts that some specialists are charging.
We are looking at a range of solutions. One is to try and get the message out to the public that there is no relationship whatsoever between fees charged and the quality of service you provide.
Is the health system equitable? Ben Harris from the Mitchell Institute says the steep fees charged by specialists mean the wealthiest Australians also end up being the healthiest because they can afford the gap or co-payment.
People in higher socioeconomic areas go to more specialists than people in lower socioeconomic areas. We know that people in higher socioeconomic areas are able to pay co-payments. Co-payments for medical specialists in Australia last financial year were $1.5 billion in out-of-pocket costs. 1 in 13 Australians did not visit a medical specialist that they were referred to because of cost.
For those without private cover, the only option is the public waiting list.
I was choking awake in my sleep about 6 or 7 times a night. So every night I wasn't getting really any quality of sleep at all. This is Jonathan speaking.
As a spokesman for Choice, Jonathan Brown knows all about consumer rights. He's also an unhappy customer when it comes to Australia's public health system.
I'm kind of just tired all the time. And it really does have an impact on your life when you're waiting on surgery and you just don't know when it's going to come around.
Jonathan has severe sleep apnea, a disorder which affects 25% of men and about 9% of women. It stops airflow to the lungs. So while he waits for surgery, Jonathan sleeps with this device every night.
It makes life bearable, but sleeping with a machine isn't what I expected for my life at 30.
Jonathan joined the public waiting list for surgery to remove his tonsils when he was living in Victoria. After waiting for more than a year, he moved to Sydney for work.
I found out that once you move states, you just start all over again completely.
So you were back to the bottom of the line again?
I came to New South Wales and my process started all over again. I had to go to a new GP, get a new referral, see a new specialist, and go on a completely new waiting list.
He's now been waiting for 2 years.
Waiting lists are a very high profile and political issue. What some hospitals do is have an unofficial waiting list for the waiting list. So before you go on an official waiting list, you're on a pre-waiting list, which isn't counted as part of the official statistics.
That's what's known as the hidden waiting list. It means the official numbers don't necessarily reflect a lot of people's experiences. In 2017-18, the median waiting time for elective surgery in public hospitals was just 40 days. Over the past 4 years, the waiting time for elective surgery went up everywhere except Victoria, Tasmania and the Northern Territory, which saw the biggest drop.
If we want to keep people out of hospital, then we need to think about prevention, wellness, health, exercise.
Groundbreaking burns specialist and former Australian of the Year Professor Fiona Wood believes the best way to reduce waiting times long term is to reduce the number of people needing to go to hospital in the first place.
This is really something that we can't just abdicate and say, well, we've, the health department or the education department or the politicians. It is absolutely fundamental that we work together because we have got a great health system, but it just could always, every day, be better.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 7:30's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.